Association. Self-portraits show Van Gogh with one ear, reminding us that he, along the way, cut off the other one. But his doctor's diagnosis that he was mad may have been way off the mark. And it might have been something far different from madness that drove the great painter to such an extreme act. The principal author of the new report is Dr. I. Kaufman Arenberg. He's an otologist from the Colorado Neurological Institute and the Swedish Medical Center in Denver. And Dr. Arenberg is with us this morning. Good morning.
Good morning, Paula.
What prompted you to study Van Gogh's letters in the first place?
Well, I started in undergraduate school. I took an art course, and I read his letters back then. And one of my best friend's mothers in high school had Meniere's disease, so I was familiar with the symptoms. And it was obvious that he had Meniere's to me. I didn't do much with it until 1980, and one of my patients who required surgery, had failed medical treatment, was an artist. And I told her prior to her surgery that she was luckier than Van Gogh because we may be able to help her, but there was no help for Van Gogh's Meniere's disease. And she didn't know anything about that, and so she started reading the letters, brought them back, and we decided that we should set the record straight that he really had Meniere's disease and not epilepsy, and he wasn't mad.
So what from the letters led you to believe that it was in fact Meniere's disease?
Well, Van Gogh is very articulate, and he wrote voluminously to his friends and family. And in these letters, he described his medical illness. And in making the diagnosis of Meniere's disease, the history is very important, even today, although we can corroborate it with special testing. The history is very important, and he has all of the important features of Meniere's disease.
Explain to us what those are. We can actually take a look at what the inner ear looks like here.
Well, Meniere's disease is a disease of the inner ear, and this is the hearing part of the inner ear, and these are the balance canals, and they're connected by inner ear fluid. And in Meniere's disease, the patient has attacks of vertigo and dizziness, and these can be associated with nausea and vomiting. They also have a sense of fullness or pressure in the inner ear, and they experience tinnitus or ear noises, a ringing or buzzing type noise. Also, in the early stages of the disease, they have a hearing loss which fluctuates and can go back to normal. As the disease progresses and they have more attacks of vertigo, they tend to have a more permanent form of hearing loss.
In his letters, did he try to self-diagnose what he had?
Well, he was very concerned about the problem that he had, and he wanted to have a better understanding of it. He was aware that the inner ear may be involved, and this was pretty perceptive in the 1880s.
How do you treat it?
How do we treat Meniere's? Most patients, approximately 80%, can be successfully managed on a medical treatment of low-salt diet, diuretics with potassium supplementation, mild vestibular suppressants, if they're over 60 vasodilators, and we ask them to avoid caffeine, alcohol, tobacco, and stress.
So you say the condition can be managed. Does that mean there is no cure for this
There
condition?
is no cure for the problem. There's a lot of different causes for the buildup of fluid in the inner ear. Now, this is the inner ear that we just showed as opposed to the middle ear. And the inner ear normally has fluid just like the eye has fluid. When the intraocular pressure goes up in the eye, the vision goes down, and that's basically what glaucoma is. If the inner ear fluid pressure goes up, it can cause balance problems. If it goes up rapidly and ruptures membranes inside the inner ear, that causes the acute violent attacks of vertigo and the associated hearing loss.
Dr. Arenberg, thanks for giving us a new insight into Van Gogh's history.
Thank you.
13 minutes before the hour. Mark?
Coming up next, the comedy of Richard Lewis.